Hi ma'am, good morning. My name is Jaidin Asmad and today I am going to demonstrate the ABG procedure. So, the first procedure is do hand washing. It reduces the number of microorganisms residing on the surface of the hand. And read the doctor's orders to obtain the pertinent data. Instruct the patients regarding the purpose, the procedure, and the responsibility so that the information may alleviate the hyperventilation that when present might alter the arterial blood gas values. And there are three selected sites, which is the radial arteries, the brachial artery, and the femoral artery. So this radial artery use as the first choice, except in the case of the multiple radial artery puncture, hematoma, occlusions of ulnar artery, and the history of the circulatory impairment of extremity or the cardiac arrest. So this radial artery is a small artery. However, it can easily stabilize as it passes over the bone groove. So and it is located at the wrist. So the percutaneous puncture and pressure control is enhanced by the anatomical landmark. So after the radial artery, you have to perform the Allen test or the modified Allen test, or use the Doppler instrument to determine the ulnar and the radial artery patency. So the collateral circulation to the hand is provided by the ulnar artery. So the Allen test is assess the ulnar artery patency. So the next one is the brachial artery. So this brachial artery used as the second choice, except in the case of the poor palpation due to the shock, the obesity, or the sclerotic vessels. So the brachial artery is larger than the radial artery. So the pressure control after the percutaneous puncture is enhanced by the approximately to the bone as it entry to the patient approximately 1/2 inches above the antecubical fossa. So the next one is the femoral artery. So this femoral artery used as the third choice, except in the case of the cardiac arrest or the artery perfusions to the upper extremity arteries. So this femoral artery is a large artery. However, there is no collateral circulation available as if it is injured, because the femoral artery is located approximately to the femoral veins. So there is a potential for falls. There is a potential for false pH, PO2, and PCO2 values related to the venous blood contamination or anteriovenous fistulas. So the hemorrhage or the hematomas is possible since the blood is difficult to control. So the next step is the position of the patient. So the first, in the radial arterial puncture, the position of the patient is use a semi-recumbent position. And the second is to alleviate and dorsiflex the patient wrist is slightly using the small pillow. So dorsiflex, wrist is moved to the artery closer to the surface of the skin surface, making the artery easier to palpate. So the next one is to rotate the patient hand until the pulse is palpable. So in the brachial artery, use also the semi-recumbent position. And of course the second is to alleviate to alleviate the hyperextend arm of the patient, by supporting the pillow until the pulse is palpable. So rotate the arm of the patient until the pulse is palpable. So the next one is the femoral arterial puncture. So this femoral arterial puncture use a supine position with the legs straight. And the next procedure is the heparinized syringe and the needles. So the heparinized syringe and the needles, there are 3 steps. So the first step is to assemble the 22 gauge short bevel needle on the syringe. So the short bevel needle like diminishes the risk of the overshooting the artery during the entry. And the second one is to prime the syringe and needles with the heparin. So like with the heparin, it is also with the heparin the heparin giving only enough heparin to fill up the dead space. So in priming syringe with heparin is to prevent the specimen coagulation. However, in any heparin that is needed to fill the dead space will lower the pH and the PCO2 of the arterial blood. So the next step is to eject all the bubbles from the syringe. So you must you must eject all the air to maintain the accuracy of the blood gas values. So the next step is to prepare the sites and the finger to palpitate the sites. So the first step, there are 2 steps. So the first step is to cleanse the site cleanse the site of the arterial puncture for 5 minutes. Cleanse the site for the cleanse the site for the semeric cleanse the sites in a circular motions. Cleanse the site in a circular motion outward with the provided iodine prep swab. So the provided iodine, so in drying the provided iodine will prevent the local infection or the systematic sepsis. And the second one is that cleanse the site with the alcohol swab. So the alcohol removes the provided iodine to provide an iodine coloring from the site, thereby to increase the visibility. So in puncturing through the moist of the alcohol prepared site can increase the pain. So the next step is to perform the percutaneous puncture. So perform the percutaneous puncture selected arteries. So the first step, you have to locate the pulsating arteries. The second step is to stabilize the artery. Stabilize the artery by pulling the skin. Taut and bracketing the area of the maximum pulsation with the fingertips and of free hand. And the next step is that you have to puncture the skin slowly, like holding the syringe like pencils, and advance needles slowly with devils upward with approximately 45 to 60 degree angle for the radial and for the brachial artery. And for the femoral arterial puncture, a 90-degree angle is used. So 90-degree angle is used. So the slow, so my god, so so this is to like the slow, oh my god, the slow, this is the slow for the radial arteries. So this is the artery entry without passing, so these are the slow, without passing the rate, without passing like without passing direct. This is the arterial entry without passing directly on it. So you enter an angle that is comfortable for stabilizing your hand. So the for stabilizing your hand. So like constantly the position, or so constantly of the position is more important than the entry angle, So the next one is to after puncturing, you have to observe the syringe flashback of the blood, of the arterial blood. So like arterial blood, so the pulsation in the blood, into the syringe is like pulsation of the blood is to see the artery has been punctured. So to see the artery has been punctured, and then to see the artery has been punctured. After that is to see the artery has been punctured. And then the flashback occurs into the readily into the glass syringe. So like gently aspiration is maybe necessary to the plastic syringe. So after observing the flashback is that if the syringe is unsuccessful, you have to withdraw the needles on the surface level or the skin level. And then the skin level, and then you have, and then the angle slightly to the artery and re-advance. So the next step is that you have to obtain 1 to 3 ml of a specimen. So the amount is to recreating an additional in study if it is necessary. So the next step is to withdraw the needles while stabilizing the ballers, the brewer of the syringe, stabilizing the brewer of the syringe. This is to inadvertent the aspiration air the aspiration air, while the withdrawal with the glass syringe. So the next step is that after the to obtaining the 3 ml, then after the withdrawal, you have to apply, no, apply firm pressure, continuous firm pressure to the artery, and to the artery and to the artery for about 5 minutes until the bleeding stops. So until the bleeding stops, and then so the hematomas following the arterial blood can cause the predisposed of infection. So the next step is that you have to perform the apply you have to apply rather the you have to apply a firm pressure for about 10 minutes if the patient has a history of increasing the coagulation time. And then the next one is to apply the ice pack to help to decrease the bleeding. So okay, so after in performing, you have to protect the blood sample. So in protecting the blood sample is that the first procedure is to hold the syringe upright, express any air bubbles rapidly. So the air bubbles must alter the laboratory test result. And the second one is to alter the second one is to after you have to close the needle immediately by using the rubber stopper or the cup, so that the specimen the specimen must be airtight to prevent the alteration of the test result. And the next one, after you have to roll the syringe. And gently mix the blood and the heparin. So after mixing the heparin, you have to immerse the blood. You have to immerse the you have to immerse all the sample and in enough ice to bring into the to transport to the laboratory. So like using ice is to reduce the temperature of the sample to like 4 degrees Celsius, to the 4 degrees Celsius, and to the 4 degree Celsius, and can slow the metabolism oxygen, and can slow the metabolism oxygen and like metabolism oxygen. And if it is delay longer than 2 minutes, alter the values, the alter values. So the next one is to after that the next procedure is to label the specimen. So label the specimen, complete appropriate laboratory requisition is that note the percentage of the O2, note the percentage of the O2 therapies of the therapies if the temperature, especially the elevated, and the time of the specimen that that was drawn. So that was drawn. So the pertinent information, related to the sample that was collected is enhance the accurate result. So after label the specimen, the last one is to immediate laboratory immediate to the laboratory. So no result of any specimen, no result of any specimen that can be no result of the specimen that can be called okay, as long as there is a oh my god, I forgot. That can be called. So there is no any specimen that can be any specimen can be called. Okay, wala na. Sorry, ma'am.